Foodborne illnesses are a part of the food and beverage industry. Food manufacturers, distributors, and retailers should be aware of the potential dangers food can cause. The risk of an outbreak is much higher when people become lazy, unaware, and neglect to take the necessary steps to ensure safety. It is more than important to understand the legal principles associated with foodborne illness and how our country has laid the legal framework for this issue. In this documentary, we will look into the main factors contributing to the liability of foodborne illness. As we discuss these factors, it will become clear that the history of liability of foodborne illness reflects society's growing understanding of food safety. These laws and regulations are highly influential when considering the liability of foodborne illness. We start with the first main factor: changes in food safety regulations and increased government oversight. Here we have a long history of the development of several acts and organizations that helped regulate our food industry. Here are some highlights. In 1202, the first proclaimed food law was created by King John of England, which prohibited the adulteration of bread with other ingredients. This is known as the Assize of Bread. American colonists adopted this law in 1785, which became the Massachusetts Act against selling unwholesome provisions. In 1862, Abraham Lincoln founded the United States Department of Agriculture, and in 1906, the Food and Drug Administration was founded by Theodore Roosevelt. Both, respectively, are responsible for protecting public health and regulating stages of food quality. Today, among several other associations and federal agencies, the USDA and FDA are considered to have the most influence over our food industry in many aspects. What led to the creation of the FDA was the Pure Food and Drug Act, which is the first of a series of consumer protection laws. This act included the authorization of facility inspections and added court injunction as a remedy. The Consumer Bill of Rights was then created in 1962, which stated that consumers have the right to be protected against products and services that can be hazardous to their health. This gave consumers the framework to take action. As the food industry evolved and our understanding of food safety took shape, HACCP plans were designed and implemented in many stages of the food development process. HACCP systems were developed to help identify and prevent or control problems before they happen. Also, in this time, the Centers of Disease Control began recording data on outbreaks caused by foodborne illnesses. In 2011, the Food Safety Modernization Act was created to give the FDA authority to regulate the way food was grown and processed. This helped the FDA focus more on the prevention of foodborne illnesses. This history is the basis for the legal principles that can be applied. Among these legal principles is product liability laws, which allow consumers to hold manufacturers, distributors, and retailers accountable for injuries caused by contaminated food products. With this in place, the supply chain can be held liable if they played a role in introducing the contaminated product into the market. Another legal principle is class action lawsuits, which is a type of lawsuit that allows multiple individuals who have been affected by the same outbreak to join together in seeking compensation from food companies and restaurants. Class action lawsuits can give your seemingly small claim a fighting chance when used in conjunction with other similar claims. The last legal principle is strict liability, which has also been applied to cases of foodborne illness. This means that a consumer does not need to prove negligence on the part of the defendant. Instead, they need to show that the food product was contaminated and that it caused their illness. Strict liability has shifted the burden of proof in favor of the injured party, making it easier to establish liability. As a whole, while changes in food laws have imposed additional legal risks on the food industry, the overall impact has been positive in terms of improving food safety, enhancing consumer protection, and increasing accountability. These changes are intended to reduce the occurrence of foodborne illnesses and improve responses when outbreaks do occur. Considering the importance of consumer health and the reputations of food manufacturers, distributors, and retailers, these legal principles influence the way food is handled and highlights the importance of food safety regulations.